And we've focused recently in a report I was lead author on earlier this month about what that parents' attitudes are toward vaccinating their kids. And what we've found is a substantial gender age gap. More than anything else, the story here is that young moms are highly resistant to vaccinating themselves or their children. And so among the younger mothers, we found that roughly a third of them said that they were very unlikely to get their children vaccinated. That's our definition of resistant. When they say very, they have 5 choices from extremely likely to extremely unlikely, and they chose the most extreme unlikely choice. So we say that roughly a third of young mothers are resistant, and that this has not changed since February. In contrast, fathers of all ages are between 10 to 15% resistant. In fact, fathers have become less resistant in the past few months. However, socioeconomic differences are still very important. So we see large gaps between families who have a household income of under $25,000 a year. They are the most vaccine resistant. Families making over $150K a year are the most pro-vaccine. Same divide across education. So those with only a high school diploma are the most vaccine resistant, and those who have a graduate degree are the most pro-vaccine when it comes to vaccinating their children.
It cannot be denied the role of social media. There is so much poor information out there. For example, I had a patient last week actually who asked me about vaccinating their child, and she was concerned that she heard somewhere in the media that the vaccine causes infertility. And so obviously I took time, I educated the mother, and let her know that there's not such case, that there's no link between the use of the vaccine in adults and in the studies in children that points to infertility. Yeah, at our center, we take care of about 27,000 patients. The majority of our patients are Latino working families, with about 10% African American. And for us here, our experience has been that one of the major reasons for lack of vaccination is access to time off from work.
So, first I want to just, speak to the burden of infection. So there has been a lot of attention that's been paid to our older adult population. However, we haven't really paid close attention to really what's going on with our children. The AAP has been a great source of information, documenting that nearly 4 million children have tested positive for COVID-19 since the onset of the pandemic. However, the CDC estimates that when we adjust for underreporting and under-testing that's happening in children, that perhaps as many as 22 million children and adolescents 5 to 17 years have been infected in the US since the pandemic began. So the burden of disease can be significant. I want to emphasize that I personally have seen kids become hospitalized, and I've actually, we've had children die from COVID-19 disease. It is a significant disease, although it is not as common to happen in younger children compared to our older adult population. Kids are also at risk. We know that amongst the hospitalizations we've seen in the US, that while 60% do have a high-risk condition, including obesity, asthma, developmental delay, immunocompromise, and diabetes, we also know that 40% of children who are hospitalized have no high-risk conditions. And so we can't predict who's going to be hit more severely by COVID-19 infection amongst our children.